done a bunch.
Well, what is up, everyone? Welcome to another episode, Behavioral Health Integration. Today we have a very special guest, Jeremiah Gardner.
Gardner, you got it. Hi, Jacob.
Hey, yeah, it's really cool, everyone, because again, like especially with awesome guests like Jeremiah, it's just we kind of follow them a lot on social media, but we don't really know each other, but we like kind of know each other. So again, this is a phenomenal opportunity for us to learn more about each other and and just have a good time. So again, thank you and welcome.
Yeah, no, I've seen you in all your podcasts. You've interviewed my current boss, the Kevin Doyle, the president of the Hazelden Betty Ford Graduate School. So I'm following in his footsteps and happy to meet you. Other than social media posts, just actually talk.
Yeah, absolutely. So you currently work at the school then?
Yeah, I'm actually a contractor, but I work exclusively for Hazelden Betty Ford right now, and my primary role is with the graduate school. I'm an alum of our graduate school, so I got my master's degree in addiction studies at Hazelden Betty Ford at the graduate school, and now I'm the alumni coordinator. That's my primary role. Is we're trying to cultivate more community and connection among it's about 1,500 people who've been through the graduate school and are doing great work all over the world to help other folks. And so not just cultivate connection and community among that group, but to celebrate, the various things that people are doing everywhere.
And I remember the last episode with Kevin, he said something really cool that your school is doing where it's changing the admission policy where you don't necessarily need an undergraduate degree anymore for the most part to get into Hazelden.
Yeah, it's another path. It's an alternative pathway for people who maybe don't have a bachelor's degree, but have, demonstrated through their life and through their other work the ability to be successful at the graduate school level. And that was quite a process to pilot. It took a lot of courage because a lot of people think you're, diminishing the standards. And I think we wanted to prove through the pilot that we weren't, and that. That we were being very selective still, despite that, one requirement not being there. And so the students that have come in through that pathway have, in fact, done very well. And so the faculty ultimately voted to approve that policy. So yeah, people, that's another option it's one of the few options really for people who don't have a bachelor's degree but are interested in getting all the way to a master's degree. They can potentially jump a step with us if they've got enough other things in their life and career to demonstrate that they can be successful.
Absolutely. And now correct me if I'm wrong. Do they need any type of education, like an AA degree, or can they still get in other ways, like you said?
Yeah, there's no specific requirement, but other education may be part of what is the way as a applicant can demonstrate their ability to be successful. But yeah, there's a lot of people that, you can get admitted to a graduate program with a bachelor's degree in basket weaving, but at the same time, you might not have a degree and you've spent 25 years working in behavioral health and not be able to get in. So it just doesn't always make sense. So this gives us the flexibility to really look at people's whole, being in the end, it also helps, in some ways us reach, audiences and populations that maybe wouldn't be coming to the school otherwise.
Yeah, and I think correct me if I'm wrong, like a phenomenal example I can only imagine where it's like, let's say someone who has a high school graduate or like GED or a high school diploma, but let's say they've had a lot of life experience, they worked maybe 10 years at a treatment center doing phenomenal work, and then they want to do more in the field, and then they apply to your school. Is that kind of what it's based off of? So like an individual like that in a way?
Yeah, but it's not easy. You can't just come in and get accepted. So you still have to have, experience and, something in your life background that will demonstrate that you can be successful. So Again, we're probably evaluating people, as closely and as tough as ever.
Yeah,
But yeah, it's a beautiful thing, I think.
that's awesome. That really is.
I mean, the fact of the matter is, we just need more people in the workforce. There's not enough counselors. There's not enough people doing this work, and um, if there's barriers to that don't make sense, we need to remove those barriers.
Absolutely. Yeah. Oh God, I could spend all day on that topic. Well, because again, it's something I'm very passionate in. So I'm sure we might actually dab into that a little bit. But first off, I would love to again get to know you better. Did you grow up here in Minnesota?
I'm from South Dakota,
South,
proudly
okay.
from South Dakota. Yeah,
Midwest, okay.
and I moved to Minnesota in 1998. So um, I grew up in all over South Dakota. I moved around because well, for a variety of reasons. But I graduated from high school in a town called Britt in South Dakota, 1,100 people, class of 30. Had lived in Sioux Falls prior to going to high school at this small town. Went to college at South Dakota State University.
Jackrabbits.
Jackrabbits, that's right. Uh, and then I worked in journalism. My degrees were journalism and political science. I started working as a freshman in college and worked all through college as a journalist, and then afterwards for the Associated Press. So I was a reporter and an editor. That's my first love. I feel like I'm still kind of that's why I warned you that I might ask you questions, because
I love it. I love it.
deep down, I'm a reporter and a curious person, and I love getting to know people and telling stories. And but I was also a musician, as a reporter by day and a musician by night. And at one point, I decided to take a break from journalism. I wanted to move to Minnesota, where a lot of my college bandmates had ended up, and make a record. Like we started writing music, but it never really, scratched that itch fully. So I left my job at the Associated Press to move to Minnesota in 1998, and I ran out of money about 3 months later, and and had to get a job. So I got a job as a technical writer at a place called the Schwann Food Company.
Okay, yep.
Um, and I was going to go back to journalism after a year, but once you get a promotion and a girlfriend and your band's getting more gigs, I got stuck, and I ended up spending 12 years with the Schwann Food Company, and in training and development. I went from technical writing to writing curriculum to leadership and organizational development and kind of HR related stuff.
All right.
And that's where I got sober, was when I was working at Schwann's.
You gotta tell me though, what instrument did you play?
Guitar, and
Nice. Electric?
and some saxophone, tenor sax.
Okay. Very nice, very nice. So very classic rock, jazz maybe, or like
Classic rock, Americana, so, somewhere in that vein. Yeah.
that's awesome. I love it. I love it. Hey man, I gotta commend you though. It's like, but you took a chance. You're young, but you have the courage to like go for something and try something new. You know what I mean?
I've done that a few times now in my life. That was the first real big one, though. And to be honest with you, I do regret it sometimes. Not in a real way, but I miss that journalism. Journalism's changed a lot, so I don't know how much I miss it, but I miss what I loved about journalism when I got into it. And but the nice thing is, I've been able in the other parts of my career to do things that are sort of related to it. And but yeah, I loved it. I loved even saying that I was a reporter. It just
Oh, for sure.
that felt right to me. When I went to the Schwann Food Company, it felt good to say I was in a band and to talk about music, and that was kind of my identity for even more than my career for those 12 years. Was my people knew me as a musician more than anything. So I didn't love saying what I work at Schwann's, even though I love that company. it just didn't feel
Right.
as right as saying I was a reporter or saying I was in a band. And so eventually, 4 years into sobriety, I ended up leaving Schwann's, making another leap like that. That
Yep.
took some courage. That was in 2010.
No, that's like a great thing that you did and great life experiences. And sometimes I like asking this question to people where it's just like, are you shocked how you ended up in the behavioral health field? Like when you were a kid growing up, did you ever think that you would be in this field? Or was there like a moment in your life that was inspirational where, and again, you don't need to get too much into your recovery story if you don't want to, but like a moment where it's just like, I want to do this for my life now.
Yeah, no, I do have a moment actually. But to answer the first part of your question, no, of course I had no clue about any of this stuff. I didn't, in fact, when I was, first starting to think maybe I was struggling with, or couldn't manage my drinking, and I remember going to the library.
Mm,
Like I didn't know anybody, at least I wasn't aware of anybody in my life that was sober or who had had a problem and
right.
no longer did. I didn't have any role models really, for recovery or sobriety, and therefore no knowledge. And so I went to the library. I have a vivid memory of going to the library in my small town. So it must have been like home for the summer during college or something.
Yeah.
So pretty early on in my drinking, I guess, if I would have done that, gone to the library at my hometown. But kind of sneaking around in the library to
Mhm.
learn undercover what might be going on with me. So no, I didn't know much, and I
Like, were you trying to fix your own problem in a sense, or like
oh
what you
yeah,
viewed as like, okay, this is kind of
yeah,
problematic. What can I read to find the information that could help me or possibly help me?
exactly. Yeah, I mean, I used to make lists all the time, and I had on my list like, uh, don't drink this week or stop chewing tobacco. I chewed
Yeah.
tobacco for many years too, and but it would end up on the list again and again, and
Hmm.
it's just like it's part of being human is that you want to do things and you don't always do what's best for you in the long term to. And but I didn't get it. It didn't make sense to me that, and for most of my drinking, life. And I didn't drink till I was 18. So I drank from 18 to 33, about 15 years. For most of that time, I didn't really understand what was going on. It was frustrating. It was very frustrating to like, I was only going to come out for like a half an hour and now I'm, out all night and then,
Right.
making people mad. And, it was just very frustrating.
Well, I think a lot of people just working at treatment centers and just a bunch of different clients. It's just like a lot of them try to be that functional drinker for a long time. They try to find ways to become one or stay one.
Yeah.
Um,
Yeah. Very common. But I want to get to your question about my moment of that
yes.
led me to the field. So, yeah, when I left the Schwann Food Company in 2010, I left to go to law school in St. Paul at a place called William Mitchell, which is since merged with Hamline University's law school. So it's the Mitchell Hamline Law School. But I enrolled there in 2010. Again, that was just another leap. I was 4 years into recovery and I was feeling amazing. Like, uh, a lot of people do, like so amazing that I felt like I could do anything.
Okay.
And so it was sort of emboldening to me by that point, like, well, what do I really want to do? I don't love saying I work at Schwann's or that I do training and development. Um, what would I love to say I do? And uh, it felt like I could go back to journalism, but I'd been away from it enough time where it would have been like, I don't know. I would have probably started lower than I even was when I left, and that just felt weird. So anyway, I had thought about going to law school when I first was in college, um, and so I took the test, and I thought, maybe I could do some lawyering in the
Yeah.
space of recovery, or in communications, or in entertainment, and an area of interest for me. So I went to law school and but it was toward the end of my first semester that my moment happened. And the moment was I was driving to St. Paul from my home in Bloomington, Minnesota at the time. And I got a phone call from a friend who said, a high school friend who makes documentary films, who said, I'm starting a new documentary project about the history of addiction treatment. And he said, have you ever heard of a guy named William White, who I hadn't ever heard of at the time?
Yep.
And he said, I just got back from Chicago from interviewing him. And it was just just the weirdest moment, because I didn't know my friend was interested in that. I can't even remember for sure he was sober at that time, but I don't remember if I knew that he had gone through any process. So it was like just kind of mind-boggling. And I'm like, I'd love to help with that.
Right.
And mainly because I liked doing stuff with him. He was a musician and a filmmaker. He just did cool stuff. And now he's got a project. Now he's got a project that's sort of related to my world of recovery. And I'm like, that sounds fun. I'd like to help you with it. And so my first, big or real thing I did with him for that project was I went to Hazelden for the first time in my life to interview a fellow by the name of Damian McElrath, who passed away just a couple years ago. He's a writer. He wrote 4 books about the history of Hazelden. He also wrote several 12-step oriented books and like a history of the 24 hours a day book. He was like William White, who my friend had interviewed and who I really came to immerse myself in. He was a writer. He was a historian. He was just a thinker about the world of substance use, treatment, and recovery. And he also worked at Hazelden for many years. And so I interviewed him at Hazelden. And when I was up there at Center City, which is where Hazelden is based, the headquarters are on the initial campus. Have you ever been there?
I have never. I've always wanted to go. I heard it's beautiful there.
Yeah.
It's going to be on my bucket list for sure.
Well, I love giving tours, so you'll have to hit me up sometime.
I'll have to sign up for one. Yes, definitely.
It's but I went up there to visit, and I interviewed this fella, and I learned that there was a graduate school, and I didn't know anything about Hazelden, so it really boggled my mind that there was a graduate school. And I don't know if I took a brochure or something from there, but I ended up going to an open house for the graduate school a couple months later. Honestly, I didn't really love it. My first open house, it was quiet that day and cloudy, like things conspired against it, and it just felt a little institutional for some reason. And I just thought, I'm not sure this is for me. And so, but then I kept working on this film project and really reading William White, who became sort of my guiding light. This William White fella, he's written a number of books, which I've also got laying around here. But it kept pulling me back. And so I went to another open house at the graduate school. And we have an open house coming up, by the way, October 11th at the graduate school in Center City. Anybody can go there.
Are you still in law school at this point in the story, technically?
Yes. But I go to another open house. It's like a second open house, and I think the sun was shining. There were a bunch of people on campus. And we had a lively debate in the open house session about harm reduction versus abstinence. I mean, this is like 15 years ago. And it felt right. And so ultimately I made the leap, another leap. I left law school. I'm getting good at quitting at this point. I've quit alcohol. I quit my AP job. I quit the Schwann Food Company. Now I'm quitting law school to go to the Hazelden Betty Ford Graduate School instead. And
what's the saying? Go with your gut. Go with your gut.
Or
telling you to do something, go with it.
Yeah, or next right step, is that's part of in the recovery world. Maybe that's the next right step, is to listen to yourself sometimes. Yeah. Yeah. So that's how it started. So that I started at the graduate school in 2011.
Okay.
And I was a part-time student because I had some other project work, including that film project that I was working on. And, I had 4 internships, uh, all with Hazel and Betty Ford. You don't have to intern with Hazel and Betty Ford, but it was an on-campus program at that time.
Mm-hmm.
And I interned on a men's unit, as a counseling intern, on a women's extended care unit, as a counseling intern. I interned in mental health, doing initial mental health assessments, for a semester. And then my 4th one was with, I had to ask for the 4th one. It was kind of a special one. I'd gotten an email from somebody at Hazel and Betty Ford who had the title like Director of Advocacy, Communications and Advocacy. And I'm like, there's a job like that here? And I just asked if I could meet the guy and intern there. And so I just cold emailed him, asked if we could met, and we really hit it off. And his name is Dean Peterson. He's still a really one of my closest friends and mentors.
Mm-hmm.
But he was the chief of staff in Washington, D.C. for a congressman named Jim Ramstad, who's from Minnesota, and who was a sober guy, and who was instrumental in passing the parity law in 2008 that required health insurance, if it covers behavioral health, to cover it fairly or on par with other medical and health procedures. And so he had all that sort of advocacy experience in Washington with an actual congressman. And then after his congressman retired, he came and worked at Hazel and Betty Ford. And so when I graduated I had a choice to make. Do I want to do counseling for a while, or do I want to do something a little different? And it was kind of a tough decision, but I ultimately chose to take a job with Dean doing communications and advocacy related work.
Yep.
Because that's ultimately where I wanted to go anyway. So I started that in 2013. And
excellent.
I've been involved with Hazel and Betty Ford, well, since I got to the graduate school, but ever since.
Yeah, that's really cool. Because going back, I know you mentioned like you're kind of hopping left and right, or whatnot. But I don't like sometimes and I don't know if you believe in like the spirituality of like the higher power or whatnot. But do you also like believe like someone or something puts you in a position now that in a way you were meant to be? Like they in a way put you through so many barriers in your life that you overcame to get where you are today. And do you feel that happened to you for some reason, or for like your past experience has really helped you be the person you are today in a way?
Oh yeah, I mean, for sure that I believe that. The degree to which it's destiny, or I'm not sure about that, but I do think that everybody's different. Some people really like to have a plan that they execute and they just kill it. Others of us are a little less certain about our path and maybe have whims that we like to follow, or maybe take some wrong turns, and then we have to recalibrate. I think I'm a little combination of those two. I'm a creative artist person to a certain degree at my core, so I do have whims to follow. I'm also I think this idea of next right step is one that's really meant a lot to me over the course of my 19 years of recovery now.
Congratulations, by the way.
Yeah, thank you. Not really knowing, what's going to happen. Even when I went to the graduate school, I didn't go there thinking I want to be a counselor. I went there thinking I want to be at Hazelden, and I want to learn about all this stuff and be around, be at the center of the stuff that I was reading about. And I kind of figured it out as I went. And, but it's not always a direct line. There's been ups and downs, in life and career always. But I think one of the things, if I think about what recovery means to me, it's like a little bit of more awareness than I would have if I were, actively using substances, and not just awareness, but because of experience and knowledge that I do have to recalibrate sometimes, that I have
Yes.
ability to go down paths, you know, these days it's never substance use, but it can be overworking. It can be, food. It can be, buying things that, when you don't need them. There's just all sorts of things that can sort of trigger our human desire to kind of get out of present moment or present stress um, and that never has gone away. It's just different stuff, different days, I think. But the beauty about being in recovery is that I see that, like, I recognize it a little, and I'm able to recalibrate even when I sort of do drift in different ways, or and I just know if I wasn't uh, in recovery or on the path that I'm on, I would, if I was using substances, I just wouldn't be recalibrating. I would just I'd be seeing things to their ultimate bad end.
Absolutely. I'm kind of curious. How long has Hazelden had a graduate school program? I know it's not super long, right?
Well, that's a cool question. It's the first answer. There's two answers. The first answer is 26 years. So it started in 2000. That's when it was an accredited master's degree providing graduate school. But prior to that, it was a counselor training program. Hazelden kind of pioneered counselor training, and that started in 1964. So I think of our alumni as everybody from 64 to present day. And so it was an amazing program back then. Part of the fun that I've had in my current job is interviewing and writing stories about and getting to know people that went through Hazelden's counselor
I
training
love that.
program
I love that.
way back in the day. But yeah, it just grew to become this amazing training program, and the idea was sparked eventually to, like, well, why don't we take the next step and do what we need to do to make this an accredited graduate school program. So again, first answer is 26 years officially, but if you add in the first 36 years, it's really 62.
Well, and it really had to be the first of its kind back in the day. So a little history lessons for the kids out there. There was a time where counselors didn't need any education or degree. I think it was like sponsors who got the first ability, right, to become counselors. Like if you were a sponsor for a while, you kind of got grandfathered into being a counselor, I think.
Yeah, I mean, counselors haven't always existed. I mean, when
Right.
Hazelden started in 1949 on the farm, in the farmhouse that was the original Hazelden in Center City, there was one counselor and one patient on day one. But he wasn't a counselor because counseling didn't exist.
Right.
He was the general manager. But he was a person in recovery. His name was Lynn Carroll. One of his daughters is still alive and living in St. Paul, Minnesota. I've gotten to speak to her recently, and she's got lots of great stories. But yeah, he was not a counselor. He was a general manager, a person in recovery that wanted to help others. He was, but his humble start with Hazelden grew to become what today is counselors. And so, there were other places that have, pioneering things as well, but Hazelden was definitely one of the first places to sort of develop something that became, and Minnesota was one of the first places where counseling became an actual thing, approved by the state. And I don't have the dates handy, but yeah, Minnesota was probably the first place that actually had a formal position approved by the legislature that was an addiction counselor. And originally it was, it actually required you to be in recovery. That's no longer the case. But.
Yeah, absolutely. So I do want to get into some questions about like the state of the field that we're in, but I also think that we maybe can combine the two. But talking about your program Uplift and Uphold coming up next Saturday, right?
Next Saturday, October 11th. That's right. It's
1 to 4 p.m.
1 to 4:30 about. Yep.
So, and I'll let you talk more, but it seems like you're combining the mental health, behavioral health field with law, right?
Yeah. Yeah, it's a collaboration. Hazel and Betty Ford is working with, of all places, Mitchell Hamline, where I was in
Yep.
school before I went to Hazel and Betty Ford. Mitchell Hamlin's the law school in St. Paul on Summit Avenue. The marathoners tomorrow will run right past it
Yeah.
in their last stretch before they get into the finish line. And it's a collaboration, Hazel and Betty Ford, Mitchell Hamline School of Law, and Mobilize Recovery, which is a national advocacy group doing great work all over the country. And Mobilize Recovery is, has annual fall campaigns where they do kind of crisscross the country to mobilize recovery and advocacy at sort of a grassroots level. So Hazel and Betty Ford's been a collaborative collaborator with them for, this is, I think, the fourth or fifth year.
Host by Randy Anderson, right? Who runs or helps with the program?
Well, he's definitely involved with the program.
He's a good guy. He's involved in a lot of things, Randy.
Yeah,
Shout out to Randy.
Yeah, shout out. Hey, Randy. he's always there. He's everywhere, and
that's why I always give him crap. Like whenever I see him. Actually, I never met him in person. We just through podcasts, but he does so much where I get tired. Like seeing him on Facebook, he's always doing something. I'm just getting exhausted because I'm jealous of his energy.
Jealous, I guess. Yeah, I guess I could use some of that energy too, but I don't know. He's got to wear down every now and again, I'm sure. But
yeah,
he's really committed to recovery and advocacy for sure.
Absolutely.
And he'll be at this event as well. But Mobilize Recovery's fall initiative this year is called Campus Surge 2025. So they're having all their events at college campuses. So when we started talking with them at the outset of, early this year, we just had the idea of, well, why don't we do something with a law school? Because I don't think anybody else will think of a law school as the campus where they might have an event, and maybe we could do something unique. And everybody kind of loved that idea, and so that's what we did. We reached out to Mitchell Hamline, and they were interested as well. And so, it's going to be a great event on Saturday, October 11th. It's sort of twofold. Half of the event is really about exploring the intersections of mental health, addiction recovery, and the law. For better or worse, they're kind of inextricably linked, from drug laws and criminal penalties to health insurance laws, and from government funding for research and care, and to the reins that the legal profession tries to put on the capitalistic forces that contribute to unwellness. Lawyers suing companies that profit from addiction is what I'm trying to say.
I love that. Yeah.
Again, they're kind of inextricably linked. At the same time, the law profession has an increased risk for substance use and mental health challenges. Hazel and Betty Ford did a study with the American Bar Association about 6 years ago that really highlighted that increased risk. And of course, we need, Hazel and Betty Ford has attorneys, and you need help to, if you're in behavioral health, or if you're even in, peer recovery world, to kind of navigate and function in the complex healthcare world that we're in today. So we need each other a lot. And so we'll talk about that, and we'll talk about using litigation as a strategy for advocacy. But we'll also talk about being well ourselves. And so half of it's kind of talking about those subjects, and we've got some great speakers and panelists. And the other half is like skill labs, where, we'll learn about Reiki and how wellness dogs can be helpful. And we'll learn about some, just things that in recovery, things that we do to stay well, that can be helpful to attorneys and all of us. So it's sort of a self-care, mutual care workshop combined with an advocacy workshop. And And there's continuing education credits available for attorneys and for counselors. So if you imagine the audience, it's going to be counselors, counseling students, attorneys, law students, and then people from the recovery community and the public. So the big speakers are Minnesota Attorney General Keith Ellison is speaking,
Nice.
and Brian Cuban, who's the brother of entrepreneur Mark Cuban. He's an author, a recovery advocate, and attorney himself. He's going to speak and share some of his story. You know, he wrote a couple of memoirs, and then he wrote a couple of novels, legal thrillers. And I just read that one of his legal thrillers is going to be made into a movie. It's called The Ambulance Chaser, and it's going to be directed by Lou Diamond Phillips, the guy that played Richie Valens in the movie La Bamba.
That's so cool. That's so cool.
I think I have his book here somewhere too, but yeah, we actually have like 20 some people that are you know, going to be speaking or on a panel or in a breakout. So it's you know, attorneys, counselors. President Doyle will be there from our graduate school.
Nice. Finally get to meet him in person.
Yeah, we'll have a wellness dog named Hershey there even.
Nice.
So it's going to be very cool. And again, continuing education credits are available for folks. And I just love any opportunity to get together with people who care about being well, you know, recovery and well-being in whatever form that holds for people. So I look forward to, hopefully, if you're there, I look forward to seeing you there.
I signed up, so
there you go. And Randy will be there, and the Mobilize Recovery people they'll be coming in from out of town from their last event. And we'll have lots of Hazelden Betty Ford Graduate School alumni and students there as well. And I hope people will come.
When it starts, are there just gonna be a lot of booths around where you can walk around and network, get to know people, or is there a big speaker conference to start, then the walk around type? I've never actually been to one of these, so I'm actually really interested in how it goes.
Well, everyone's different, but this one, if you know, it will start on time in the main sort of conference area, but people get there early. There is an area with some tables, like some resource tables and refreshments and snacks. That's also going to be used at the end of the event for networking and socializing. So if people get there early, they can hang out there, but they'll also have an opportunity to do that at the end. That's kind of built in by design. Yeah,
absolutely. And yeah, it just what really got me interested in this event too, because like you said, I think there's like a lot of legal aspects and advocacy that can actually help the profession out. And I know before the show, we were talking about like a lot of issues we're currently having in the field, not just like in the field, but graduate schools, where I'm sure you've noticed like there's been less students per year applying. Is that correct? Over the years?
Not at our graduate school. I mean, we currently have 240 students enrolled, which is our all-time record for a semester.
Nice.
By 29, it's a record. So I guess I don't know what the big wide world of graduate schools or colleges looks like enrollment wise, but ours is, you know, thankfully for the field, there's a lot of people coming into it through our school.
I guess in your professional opinion, you know, when we're talking about issues, what are just a couple of the big ones you see in our field that it's not going so well? And then what are ways that we can improve it that you see?
Yeah, that's a tough question, big question. I think one of the challenges we probably faced is, well, stigma just isn't, it's never going to go away, in my opinion.
Right.
Like, I wish it would. It can be diminished, it can be blunted, but the reality is the behaviors associated with addiction, the behaviors I demonstrated and that lots of people demonstrate, are going to send negative vibes a lot of times into the ether of our society. And it's just the nature of the disease. And so my opinion is we always need to be countering that stigma. And the example I use is I remember one time I was at a Twins Yankees game here in Minneapolis, and you know the Yankees fans are, well, they're terrible. They're Yankees fans, and But there was a guy sitting right behind me who was, got particularly drunk and was
Oh,
berating an elderly woman that was sitting next to him. And I don't even remember what he was berating. I just remember he was so mean to her,
wow.
and it was just ridiculous. And um, my first thought was not get that guy some health care.
Right.
It was get that guy out of here. I
Right.
had negative energy in reaction to this guy, even though I'm a person in recovery, I'm immersed in the field. My initial reaction was not get that guy some health care. And I think that's, a little bit of a metaphor for just how society is. We're always going to probably have negative things that are our first reaction when it comes to addiction.
Mm-hmm.
But we need the whole world to be a little bit like you and I are, which is to understand enough to be able to catch ourselves and say, wait a minute,
Mm-hmm.
that maybe, that guy is being ridiculously rude. And I do hope he does get out of here, but I also hope he gets help, just, and
Right.
so, so I think we need to realize that public education is, just like it was at the beginning of Hazelden's existence 76 years ago, was an important part of helping people, was public education. And it still is today. I just don't think it's ever not going to be an important part of our part of healthcare. Unlike, healthcare for cancer or any other sort of medical ailments, you just don't have to constantly be educating over and over again because you don't have the behaviors that you have to overcome.
Mm-hmm.
And so I think that's one challenge. It's not a new challenge, but for me, it's a new challenge in the sense that I've come to believe that like we just have to have that as a priority forever.
Mm-hmm.
Another challenge is that it was during my time at Hazelden Betty Ford that the field adopted a spectrum disorder, changed it from kind of addiction and alcohol abuse. There were really just two buckets when you diagnosed people in the past
Mm-hmm.
and they had a different number of criteria. If it was, all the criteria, they were in the um, addiction bucket. And if they had, a lower number, a certain number, they'd be in the alcohol abuse.
Mm-hmm.
And then we created a substance use disorder spectrum where there was, you could do mild, medium, or severe substance use disorder. And it seemed to make sense, but and it probably has had some benefits, but it's also created challenges where that I think we're just starting to wrestle with, or not just starting, that we're really wrestling with in terms of, it messed up our data, or it changed our data. So instead of thinking of, 20 million people being affected by addiction, we're talking about 46 to 50 million being affected by substance use disorder.
Sure.
It started blurring the line between, somebody with a mild substance use disorder and a severe, kind of putting them all in one bucket in a lot of ways as we think about, the treatment that we provide, the resources that we invest,
Mm-hmm.
the funding that gets allotted, just the way people think about it. There's, all the discussion about what is recovery, what's not recovery. And, when you're talking about the whole range of mild to severe, it makes sense that people are going to have all sorts of different views
Right.
and experiences with what is recovery and what kind of care or help or resources make sense. So, you know, with people with severe substance use disorders, which is what traditionally we've thought of as addiction and what, the care system's been oriented around and where the funding's been oriented
Right.
around. Abstinence has always been a good, like the recommendation that would have the least risk associated with it for patients.
Mm-hmm.
Healthcare providers are sort of obligated to recommend and steer people toward whatever is going to be the least risky for them.
Sure.
And, abstinence comes with the least risk for most people that have severe substance use disorders. But there's a lot of people, as we know, from that at different times in their life might, technically fit the mild or medium substance use disorder diagnosis, and may grow out of it, or may uh, uh, switch substances to get away from this problem, and then eventually stop this substance. I mean, there's just all sorts of different
Cross
paths.
addiction. Yep.
Yeah, there's all sorts of different paths, and then we get in fights about what paths are the right paths, what paths aren't the right
Amongst
paths.
ourselves, almost, right? And like
Yeah, amongst ourselves, but we're not always talking about the same thing either, because we've created this big bucket where the progression, or the path for somebody who's on this end of the spectrum can be wildly different than what the path is for somebody on this end, and the solutions too. So I think that's a challenge, is we need to maybe better define the terms and the spectrum, and how we talk about these things.
Absolutely. I think those are all phenomenal points too. And I think also going more into, like, let's say the professional, like, advocating for, like, let's say, like, higher reimbursement rates from insurances, or trying to figure out, like, why are so many therapists, like, leaving the field today? Again, going back to, like, low reimbursement rates, issues with insurance not paying us, and so forth. And I'm sure, obviously, especially in the news nowadays, like, all the treatment centers, like, again, getting shut down for fraud, Medicaid, Medicare fraud, and so forth. Like, and maybe that's more of like an external system too, or a big picture, but yeah, all really important things too.
Well, we now have the system and society doing the same thing that people like me do when we're in the midst of a severe substance use disorder, and that is trying to do as little as possible to change. And so as a result, you've got people and the system encouraging the least possible help, the least possible interventions. And of course, the people who are in the midst of addiction want the least possible too. They like to avoid it if possible, in most cases. So, through the opioid crisis, the last 15 years, the last 20 years, 25, a ton of money went into came out of compared to the past. A ton of new money came from opioid lawsuits, and from Congress deciding to devote more money, and went to fund a lot of good stuff like recovery community organizations and naloxone distribution, and so you guys saw a lot of different organizations pop up all over the country doing good work in their own space, but it not too coordinated though. And there's a not too coordinated, and also never really, nobody proffered that maybe a solution is people need more care, more treatment. I mean, that was never the solution. It was I guess Medicaid expanded. That was a huge deal. Lots of people who wouldn't have otherwise got treatment did get treatment through Medicaid expansion. But the idea of, maybe people need more time engaged in care, some level of care, it just wasn't part of the debate.
Absolutely.
Wasn't one of the solutions. And so as we've sent a lot of money in and tried a lot of new things, and created a lot of new advocates and sort of recovery warriors to try things, we've at the same time slipped into a less treatment. And I'm talking about system wide. It's a little different from state to state, community to community, and provider to provider for sure. But to your point, the reimbursement rates have always been pitiful,
Right.
and compared to other healthcare, and even addiction services reimbursements have been far lower than mental health. And so
Mhm.
there's even a stigma, I think, at play there where addiction hasn't caught up to mental health for the most part. But, places like Hazel and Betty Ford are really doing some interesting and
Nice.
great things to really create co-occurring care where there's less distinction between whether it's addiction or mental health. It's
Right.
both.
Mhm.
And that's sort of a new paradigm, I think, for insurance companies to contemplate too. Um, and so, but this is another area where you need lawyers. You need legal,
Exactly.
to
Exactly.
help enforce the laws and the requirements, but also to advocate on behalf of the system that needs them
Amen.
and the
Absolutely.
people that need them.
I see. Well, as we're winding down, I just want to say thank you so much for being on the show. It was great. I really enjoyed learning about you, your story, and this event coming up. But before we close everything out, if anyone wants to get a hold of you or communicate with you, what's the best way to do that? Like website, email, or
Yeah, I'm on all the social sites, but yeah, LinkedIn is probably a good starting place. Yeah, Jeremiah
okay.
Gardner. Um, and I'd love to hear from people. Absolutely, for sure.
And then just double check the event is next Saturday.
Next Saturday, October 11th. Yep, William Mitchell in School of Law in St. Paul on Summit Avenue. It's 1 to 4:30, and it's going to be great.
And I will make sure I put that link in my show notes too, so everyone knows where it is and all the details too.
Yeah, there's a registration page, so if you're interested, please do register. There's no cost though.
Nice. Nice. Well, again, thank you so much. I greatly appreciate it, and I guess I'll see you Saturday, our next
I
Saturday.
will. Yeah, I can't wait, Jacob. I could talk to you all day. So thanks
Yep.
for your interest and for all the work you're doing to, I don't know, educate the public and engage, all of us.
Greatly appreciate it. Thank you.
You bet.
And